Good day, ma'am. I am your student nurse, Marmar Cabigas from BSN 2C. So for today, I am going to demonstrate to you the steps in performing the bag technique actions. So bag technique, it is a tool that will allow the nurse to perform a nursing procedure with ease and deftness during her visit, saving time and effort. And of course, to render effective nursing care treatment to the patient during her home visit. So here is my OB bag. Upon arriving at the patient's home, we need to look first for a suitable place where we can place our bag. So most likely a table, a flat surface, and we need to align that table with the use of our plastic and paper lining. So this is done for us to protect the bag from any contamination. So let's now align the table with the use of my plastic lining. So the clean must side out and the folded part touching the table. Next, we're going to line that with the use of our paper lining. So this is to ensure that the bag will not be contaminated. Same also, the clean part must side out and the folded part touching the table. So finally, we can now put our bag on the top of the table. Next is ask for a basin of water. So this is done to be used for hand washing and avoid infections. So we're going to open up our bag to get the soap and the towel. So this to prepare us for hand washing. So I've already done performing my hand washing. So next is take out the apron inside the bag and put it on with the right side out. So this is to protect our uniform and to avoid some body fluids like blood and saliva and other microorganisms. Next is put out all the necessary materials that needed for specific area. So I have here my thermometer to get the temperature of my patient, a gauze pad for wound dressing, a bandage scissor, a micropore as a securement, a cotton ball that's filled with alcohol to clean the wound of my patient, a tape measure to measure how small or big the wound of my patient is, wipes for sanitizing, and iodine as a cleansing solution. So this is done to make them readily accessible. Next is close the bag. This is to prevent from any cross-contamination and to give comfort and security. So let's assume that I've already done performing a nursing care treatment to my patient. So after providing a nursing care treatment, we need to clean all the materials that were used and perform hand washing. This is to protect the caregiver and avoid transmission of infection to others. So after sanitizing, we're going to open the bag and return all the materials in their proper places. Next is we need to perform hand washing. So this is to prevent transmission of any infection to others. Next is remove our apron, folding it away from the person. So the soiled must side in and the clean side must side out. Then place it inside the bag. So this will help us to prevent from any contamination. That is why the clean must side out. So after disinfecting everything and washing our hands, we can now fold the lining and place it inside the bag. So we have now kept everything inside our bag, all the lining paper, all the equipments. So now we will now discard all the material used in a proper receptacle bin. Finally, take the record and have talk with the mother or the client. Write down all the necessary data that were gathered, all the observations, and the nursing care and treatment rendered. Give instructions for care of patients in the absence of nurse, then make an appointment for the next visit, taking note the date and time.